the Bald Oncologist Podcast Series, featuring Dr. Malwonder.
Profesor, tenaga batin saya sangat lemah lepas radioterapi. Saya tension.
Oh, jangan takut. Kita ada penyelesaiannya dan ada cara untuk mengatasi masalah ini. We always have a solution for this problem.
Oh, terima kasih, Prof. Alright. So, welcome to the Bald Oncologist Podcast Series. Today, we'll be talking about men's health as it's Movember. So, we have in our studio today Prof Ong. He's a very renowned consultant oncologist pula. Okay. So, in our studio today, we have a very well-renowned consultant urologist, Professor Ong. So, Prof Ong, what I understand from my patients, for patients who actually go through prostatectomy or even radiotherapy, and when you go for hormonal therapy, sexual health is a major issue for them.
Yes. Right? In fact, it is. Yeah, it affects a lot of patients after treatment for prostate cancer. Of course, the severity will differ between different patients and different stage of disease. So normally myself or even oncologists like you, we can assess them, can advise them accordingly.
But I can't treat them. I really don't know what to start for sexual health problem. Normally I'll send it to my urologist.
Yeah, of course. But you have the the knowledge and the know-how.
Yeah, I can identify them.
Right.
Yes. Okay. So, which treatment normally cause a lot of problem in terms of sexual health? Is it the surgery or the radiotherapy, or is it a mixture?
Yeah, I think it's a mixture. Yeah, each got its own proportion of patient with problem with erection. We call that erectile dysfunction, ED. Yeah, surgery there'll be a percentage of patient with ED, and of course radiotherapy there will also a percentage of patient with ED as well. Of course, it's a time of onset. With surgery, you see it almost like immediately, the side effect of erectile dysfunction. For radiotherapy, this ED problem might come a bit later.
Yes.
And also these are also complicated by the fact that for some patients, they are on androgen deprivation therapy, ADT, that reduce their hormone level. That will also have an impact on their sexual function.
Correct.
So these are the few factors that we need to juggle.
So how do we treat this kind of patient? Is it the same like a normal population with erectile dysfunction, or there's a separate treatment for cancer patients?
Yeah, this one, I think to tackle this problem, of course, you want to see the stage of the disease, the treatment method, and the overall health of the patient. The treatment method available, it is quite consistent with those treatment that's available for patient with no cancer.
Okay.
Those with erectile dysfunction and no cancer, of course, we treat it generally in principle the same way. But of course, it will be more challenging in patients with cancer, right? Already there's a psychological pressure on them in terms of have to facing the cancer itself and the side effect of the treatment. So that will complicate the picture. So we need more attention from the doctors, myself, the urologist, and also from the oncologist.
So they need some social support also from a psychologist.
It's not so straightforward. Yeah. Of course, you want to go to detail. It will be once the diagnosis is established and the patient is keen to regain their sexual capability. So we normally start with medication first.
Okay.
Yeah, medication will be the first line for patient. The commonly available is PDE5 inhibitor, phosphodiesterase 5 inhibitor. There are many brands available. They are commonly available in the market. I think a good trick is for us to be familiar with the medication, and then we can prescribe them to the patient. And of course, the pharmacy, in the local pharmacy could help by advising the patient on how to take the medication, the duration, the mode of action, and so on.
Can this be taken during treatment, like during radiotherapy or during the hormonal injection?
Yes, of course. There's no contraindication of not giving this medication to the patient during treatment. Because this PDE5 inhibitor, the main contraindication are for patients with severe heart disease and a patient on nitrate medication for the coronary artery disease. Otherwise, it would be quite safe to give to the population of patients with prostate cancer.
Okay. Any surgical method which they can go ahead? Or any non-medicational, because some patients don't like to take medicine.
If the patient, does not respond to medication, then we go for second line treatment. So for patients who do not respond to first-line medical therapy, if they still keen on treatment, there will be second-line therapy. The first one will be vacuum pump devices, which is quite widely available. Okay. It'll be good to go through a doctor to recommend a proper brand of vacuum pump. I receive feedback from patients claiming that the vacuum pump is very effective.
Is it very expensive?
It's not expensive. It's not too expensive. Yeah,
okay.
It might cost from a few $100s to a few thousand ringgit. Yeah, but of course, this is most of the time is kind of a one-off payment. You buy the device, it's already there, so you can use it for quite a long time.
So where can they get this thing? Is it like in the pharmacy or retail pharmacy, or do you need to get from the hospital?
Yeah, so there are different sources to get the vacuum pump. The urologist or the relevant doctors with interest in treating this disease, they will have their supplier. They will know which source to get the vacuum pump from, or the patient can ask the local pharmacy. If they buy it online directly, we of course we will not know the quality and safety of the device. Of course, there are people who do that. Yeah, we generally do not recommend that. Yeah, so that's one way, vacuum pump. Another way is direct injection of intracavernosa injection to induce an erection, but that involves an injection to the penis. So it is currently not so commonly practiced. Yeah, of course, if it go further to third line, for patients who really don't respond to anything, penile prosthesis. Yeah, meaning put a kind of
implant.
Prosthesis implant into the penis. That will be the third line of management. But of course, it's not commonly practiced in this country due to the cost of operation and so on.
So the penile injection, is it a one-off thing, or you have to do it multiple times?
Yeah, so that's the catch, right? You do it one jab, it only lasts for that period. Yeah, the last for that 1-2 hours. So you want to
each time you want to have a sexual intercourse, you have to jab.
Yeah, so that is the barrier. Yeah, imagine that every time you or me need to have the erection, to have sexual intercourse, you need to put a needle into the penis. So it might not be very attractive to the patient.
Who will do the injection? Is it the doctor or the patient can do it themselves?
Yeah, this is for the patient to do it themselves.
Oh, okay, so you can do it at home.
Yeah, so you need to do it at home. Yeah, so there are such medication available in the market. There's license for use. But normally the first round or second round, the doctor will have to teach the patient how to administer the injection. Yeah.
Okay.
So after that, the patient is actually expected to perform this maneuver themselves. Yeah. So that is why these are the second line treatment. So that's the main key. That the main point is that very important for us to optimize the medication part, the PDE5 inhibitor. Yeah.
It's the easiest one. Just take oral.
Easiest is the oral medication. Some people even start that before the treatment itself. Got the medication PDE5 inhibitor act by improving the blood flow to the penis and the genitalia. So that will prepare the organ for future performance and improvement. So the widely available one, the generic name will be sildenafil, tadalafil. Those are the medication. So we just need to know how to prescribe that, and advise the patient. Of course, there will be a very good pharmacy support to advise the patient further on that. So that is on the part of medication, vacuum pump, injection, and so on. But on another aspect, the general health of the patient in terms of exercise, diet, sleep, weight control,
all the sedentary lifestyle,
and all that, right? Yes. So that's equally important, right?
All right.
So if you all the medication, but you continue smoking, you continue not to exercise, continue to not sleep, I think that was actually quite detrimental to their overall health.
Yeah.
So not only to the cancer, it's not good. That you are not taking care of yourself. So if you take care of yourself in terms of general health, exercise, weight, diet, sleep, and so on, that will, I think, not only improve the sexual function, that will improve the recovery from any intervention, for the cancer, right?
Correct.
So it is win-win, right? You beat the cancer and you recover your sexual function and you get better overall.
Yep. So there you have it. You actually have many options available for sexual dysfunction even when you're on treatment. So Professor Ong, is there anything else you want to tell the audience as a final say?
Yeah, I mean, the main message is, whether you have cancer or no cancer, it's important to take care of overall health. All the detailed medication that we mentioned, those are very specific treatment. Of course they work. But most important is for us to take care of our health in terms of getting adequate exercise, proper diet, getting adequate sleep. A lot of people don't sleep well. I think sleep is important. And also all the psychological stress and so on. And of course, those kind of habits like smoking, drinking, alcohol excessively, those things we should avoid. I think that's important for everyone and for you to pass this message to your friend, to your family, and to yourself.
Okay. So thank you so much, Professor Ong, for being in our show today. Thank you.
Thank you.
The Bald Oncologist Podcast Series